The White House claims Obamacare helps small businesses and makes healthcare more affordable, but actual small business owners say something very different. I've got editorial board member Steve Moore joining me now from Washington. Steve, I'm going to put up a slide here. It shows how will the Affordable Care Act affect your small business franchise? A survey of small businesses. 64% said it had a negative effect. Steve, why?
That's amazing, isn't it? And by the way, all the Obama administration needed was more bad news about Obamacare. But you're right. This was one of the central promises that was made, Mary, back in 2008 and 2009, was that we would have Obamacare and small businesses would love it. It would make insurance more affordable and easier to find. And now we're finding exactly the opposite, that when you actually ask people who own small businesses, the employers in this country, by about a 10-to-1 ratio, they say that it's a negative for their business rather than a positive for their business. This is a big problem. Let me just add one other thing, Mary. The poll also showed that you've already got nearly a quarter of all businesses between about 40 and 200 workers that are saying they are moving to part-time workforce because of the new mandates under Obamacare.
Yeah, there's some pretty stunning statistics. Public Opinion Strategies is the pollster here. But Steve, can you explicate a little bit about why businesses don't like Obamacare? What exactly are the costs that are being inflicted upon them?
Well, first of all, when you're talking, one of the big groups that was surveyed was people who own franchises. These are people, Mary, who own McDonald's and Burger Kings and Dress Barns and stores, customer stores. And you're talking about people who make, between $10, $15, $16, $17 an hour. It's very expensive for those kinds of companies to pay health care benefits for those workers. They may have to lay off a lot of workers if they have to do that. So in anticipation of Obamacare, they're moving to part-time workers, because if you have part-time workers, you don't have to pay them all of these benefits. The other thing, interestingly, that we found was, you've heard the term 49er, Mary, not San Francisco 49ers. These are businesses that are, keeping their employment down below 49 workers, because once you hit that 50 worker threshold, all of these new costs, all of these new mandates under Obamacare hit the business, and you're talking about hundreds of thousands of dollars of new costs.
Steve, about a minute left. Are there any better solutions here? Any bills on Capitol Hill that we should be watching?
Well, first of all, let's repeal the whole law. I mean, there's nothing is working here. So there's a strong case for repealing this, or at least delaying it for a year. But I like this proposal that has been proposed by Joe Donnelly, who's a Democrat, by the way, in the Senate from Indiana, and Susan Collins, a kind of liberal Republican, who are saying, okay, let's at the very least define a full-time worker as what we've always defined full-time work for, Mary, in this country for the last 50 years. 40 hours a week. Mary, when did 30 hours a week become a full-time job? That's not, you and I are working more than 30 hours a week, I assure you
well,
of that.
Steve, we're working more than 40 hours a week, too.
You got it.
I'd love to work 40. Editorial board member Steve Moore, thank you so much for joining us.
Thank you, Mary.